Good morning, everybody, and welcome to this session, Taking Positive Action to Promote Professional Improvement. My name's Gavin Moorghen. I'm a social worker and I work here at Social Work England. I'm very excited to be opening the session today. Please bear in mind as well that the information or opinions expressed by any third parties are are opinions that we don't necessarily own, and they might not and they don't necessarily reflect the views of Social Work England. So, without further ado, I am now going to pass to our chair at Social Work England, Andrew McCulloch. And Andrew, it's over to you.
Yeah, thanks, Gavin, and hi, everybody. Thanks for joining this session, which is about something that's very important to us at Social Work England, because, of course, our fitness to practice process is there for public protection and there for credibility. But it's also very important to think about what we can learn from the process so that we can learn perhaps with partners, with employers, how to prevent fitness to practice cases in the future, and also how better to handle those fitness to practice cases which do have to sadly occur. And key to this is a partnership with employers and a partnership particularly with local authorities as the major employer. And I've learnt right through my career about how important partnership with local authorities is. Years and years ago, I was running the London Homeless Mentally Ill Initiative, where it was absolutely crucial to work across agencies to get the learning and to get people off the streets into somewhere decent where they could have dignity. So what is this partnership going to be about? Well, as I've said, the learning, how to prevent, getting the right cases coming forward, because there's nothing worse than getting cases where really there is no case to answer and where it didn't need to come to us and where people didn't need to be concerned or bothered. And also maybe in the long run, getting less cases. It's not really for us to say, um, to the public, you can't bring your cases forward. Of course, that's not the role, because we're here to serve the public and we're for public protection. But if we can get this right together, then we could have less cases, we could have cases better dealt with, and we could have more learning. So that's what this is all about. So we need to work together in this difficult environment we're working in to get the best outcomes for social workers and for the people they work with. So I'm going to start. This is really in two sections. I'm going to start by asking Social Work England colleagues to explain what they're doing, what we're doing, and then I'm going to some local authority colleagues who I'm very pleased to have with us today to talk about it from their end. So first of all, I'm going to go to Stephen Bartlett in Fitness to Practice at Social Work England and to Gavin again, who are going to talk us through what we are doing. Stephen and Gavin, over to you.
Thanks, Andrew. So just introducing myself, I'm Stephen Barnett, Assistant Director of Regulation at Social Work England. I'm just going to say a little bit about our fitness to practice work and also introduce the single point of contact network that we've established with employers over the last 2 years. So the nature of fitness to practice work means that our teams will obviously need to have regular contact with employers. We receive referrals from employers as well as members of the public, and our triage teams who will initially deal with those referrals. They'll routinely contact employers at the beginning of a fitness to practice case when the referral's received, and then we'll stay in contact during an investigation and indeed throughout the entire process. We'll be requesting information, clarifying details, and then liaising in terms of outcomes. So over the last 2 years, our regional engagement leads have been working with local authorities to establish a network of single points of contact, or a spot network across all local authorities in England. The network provides, as it says, a point of contact for all our teams, and an individual to liaise with throughout the sort of life of a fitness to practice referral. And whilst we will need to have contact with different relevant managers throughout a case, having that network gives us a consistent contact to Social Work England, but it also means that there's the sort of knowledge and expertise in fitness to practice being built up within each employer. So the spot network, it's across local authorities in England, and it's a key mechanism for us in terms of improving the sort of two-way contact and the relationship that we have with employers. So over the last couple of years, our work with the network, it's helped us, I suppose, from a day-to-day perspective in terms of day-to-day exchange of information, helping sort of make interventions where appropriate to help move on fitness to practice cases which might be getting stuck in relation to either information that we need to receive, or indeed sort of having contact with the relevant individuals across a local authority. And I suppose more broadly, and increasingly over the last 12 months, we've just started to look at key themes with the network. So key themes that are coming out of fitness to practice referrals, sort of building up a shared understanding of fitness to practice between ourselves and the network, and then as the network develops more, starting to look more generally at what information we can exchange so we can learn from each other, and as Andrew said, starting looking at themes such as prevention as well. So that's my kind of general overview. I'm going to hand over to Gavin now.
Thank you, Stephen. From my point of view, I'm one of the regional engagement leads, and some of the people attending today may be aware of this, but for those of you who aren't, we have a team that covers the whole country, England, that is, and what we do is we have, as Stephen's just alluded to, is we've spent time building relationships with employers of social workers. We haven't obviously managed to get through all, but we started by targeting local authorities, and we've been working, and we continue to work on building that with other employers such as NHS trusts, and it really required us sort of effectively knocking on the doors really of the different employers, and explaining why we thought it was important for us to have these working relationships. And what has helped is our team is made up of social workers, so we understand the context of social work. We've got a team that is but we both know the areas that we cover, but we also know the profession as well, and that really did help in terms of building relationships. And with the single points of contact, they're nearly always, well, in most cases, they're social workers themselves, and most across the country are principal social workers. And that was a really good way of developing those relationships. And what it's enabled us to do is to initially our view was we could use this to deal with some of the backlog that we inherited as a relatively new regulator, and deal with any and try and deal with any delays in the fitness to practice system. But we didn't just want this to be about what we could get, and meeting the needs of ourselves as a regulator. We also thought to ourselves, how can we bring value to the organisations that employ social workers. And so by doing that and taking and thinking about that principle, we've been offering things like seminars and workshops for leaders of social workers and social workers themselves, getting people really understanding what the fitness to practice system is, why it's important. And although, you know, we have to acknowledge it's not something that people necessarily want to happen, but it's an essential part of regulation. It's an essential part of public protection, and that's the kind of message that we've been giving. And we've also used that opportunity as well to talk about some of the thematic issues that come up in fitness to practice matters, and we're spreading the word really about what that is. And this isn't just for the sake of doing it. We're also looking at this from the perspective of how can we assist employers and social workers themselves to look at how we prevent fitness to practice issues arising in the first place, and where they're not preventable, what we can do to ensure a timely referral into the fitness to practice system and a proportionate referral as well. Another thing that we're working on with employers is trying to deal with some of the diversity issues that have come up, some of the overrepresentation of certain groups in the fitness to practice system, and look at why that might be happening and what we can do to potentially to turn that round. So there's a number of things that are going on here from Social Work England in partnership with employers around the country. I would say to anybody here today who is in a position where they're able to do this is to encourage engagement with the regional engagement lead. Maybe you're an employer yourself, maybe you're somebody working in an organisation where you think that relationship will be helpful, and you can find the details of the regional engagement team on the Social Work England website if you want more details of that, and if you think that might be beneficial. And we're always keen to visit. It's usually online, but we can sometimes do in person where it's feasible. But what I'm going to do now is pass back to Andrew.
Yeah, thanks for that, Gavin, and thanks for mentioning the very important issue of data and insight at the end as well, because unless we analyse the fitness to practice cases, we won't know who's overrepresented. And unless we get underneath that, which is what we now need to do, because we do know who's overrepresented, we need to look at solutions and prevention around that. And that's very personally important as far as I'm concerned. I'm very pleased now that we've got 3 local authority colleagues with us to talk to us today. I'm just going to let them run through once I've introduced them, because we're on a fairly tight time scale. But I'm very pleased that we've got Joanne Thompson from Gateshead, Kaylie Chapman from Wiltshire, and Kathryn Speight from Sheffield, from sunny Sheffield, where we are located as well. So welcome to all 3 of you, and over to you. We're keen to hear from you.
Thanks, Andrew. I think it's me to go first. I'm Jo Thompson. I'm the Principal Social Worker for Adult Services in Gateshead. And I'll highlight as well many of the different roles that I have within my local authority. I'm a practice educator, an approved mental health professional. I'm a member of the senior management team. I'm lead for ASYEs, and I'm also the single point of contact, or the SPOC, as you've heard it referred to earlier, for Gateshead Adult Services. So, as I know, with talk, many of you will have many competing responsibilities within your roles, and I suppose I demonstrate that I too share that. But quite appropriately, my role as SPOC has not really required, frequent interventions in terms of referrals for fitness to practice. And I know through my work with Skills for Care on the work race equality standards that many SPOCs within local authorities have that similar experience, that, this is a role that sometimes does require intervention, but it's not something that's commonplace. I've attended the SPOC network, and I've felt ready. And although potentially nobody should ever feel confident with the SPOC role, as it is a very challenging role with many responsibilities. But one thing that I have learned in my time as SPOC is that often team managers and senior colleagues have potentially known about issues that a colleague social worker might have been having within their practice for some time before it becomes highlighted to myself as SPOC. And I've found that, often I can spend quite a bit of time with managers considering, issues that might be bespoke to that individual social worker, and asking questions and really working to support to ensure that there's been equity in the experience in the practice situation, and that we've done everything to understand the challenges or the differences that a particular social work colleague might have experienced and what our actual individual response has been to that, to that particular social worker. I ask lots of questions around what the plan has been around that particular social worker, and I try to, explore that in detail. And is there anything more that we can actually do in terms of a plan around that person? Look at issues like the frequency of their supervision and what their opportunities to learn have been. Have we actively done everything to support that individual in their bespoke situation? And also, I think one thing that's really important to consider is the context within the team that the social worker is working. Has that been a supportive context? What have the pressures been, to that particular social worker? And is there anything more that can possibly be suggested and worked alongside with them before any contact with Social Work England? I think there are going to be some time for questions later, but that was all that I really particularly wanted to say today before handing over to Kaylie, I think it is.
Thanks, Jay. So hi everybody, I'm Kaylie Chapman and I'm the Principal Social Worker at Wiltshire Council. I was just kind of talk through my experience really of being a SPOC and how I've kind of found the support with that from Social Work England in terms of fitness to practice. So I myself, I've been enrolled as Principal Social Worker for just over a year now, and when I first started it was really helpful that it coincided with one of the SPOC network events which Social Work England run, which really helped me to link up then with other SPOCs across the network and talk about those overarching issues that may be coming up in terms of practice, and to really recognise what your role is within your organisation to really support the standards that we have as social workers and recognising when those fitness to practice concerns are in place. I have really been able to link in with my regional engagement lead, so like Gavin mentioned, I've been able to speak with them quite regularly, and we were also able to run a in-person event in the council, which was really positive, where they came along and spoke about fitness to practice, just to raise that awareness of what that really means, and that was a session that we were able to run across both adult social care services as well as children's services, and as well as our HR colleagues within the council, so they could really understand those processes when it does come to fitness to practice from a Social Work England perspective alongside the HR process. I myself haven't become involved in very many fitness to practice issues. In terms of the investigation, I think one thing that we really want to do initially is work with that social worker where there is potentially some practice concerns, to really support them in the team that they are and really adapt even the way in which they're practicing, or making sure that we have got that focus on their well-being so that we can really support them through the issues before it escalates to a fitness to practice issue. We are really keen in looking into the data and insights that we do get as SPOCs in terms of where the fitness to practice issues are lying and where that's coming from. So I know most recently we kind of had those figures in terms of honesty within practice is one of the big areas which we have been kind of looking at focusing on. So a way in which I am ensuring that internally we are working with that in my role as PSW is by making sure that we have the right training in place in terms of what that looks like, and also in terms of what that looks like when it would get to a fitness to practice issue. So where potentially that dishonesty can then escalate to something where we would need to inform the regulator to do so. But all in all, I would say within the role, I do find the regional engagement leads and then the colleagues that we speak to from the fitness to practice team are really helpful and really supportive in the process. And I think, like Joe mentioned, it doesn't take up a vast amount of time of your role. It's just, maintaining what you do as a principal social worker, but also having that link in with social working to ensure that, all of our workforce that are registered as social workers are meeting our standards that we would want, both internally, but also to the public that we support. And then I think I'm handing that over to Kathryn now.
Thanks, Kaylie. Hi everyone, I'm Kathryn Speight. I'm currently the interim principal social worker for Sheffield Children's. I am the outgoing SPOC, though a colleague will be taking over my role. But I have been the SPOC in Sheffield for 2 years. So I think, just building on everything that Joe and Kaylie have already said about really developing and establishing those relationships with your regional engagement lead has been really important. For me, in the SPOC role, we had a fitness to practice session with our regional engagement lead at the beginning of the year, which was attended by about 50 of our frontline managers and service managers, which really helped to demonstrate the some of the themes as already been mentioned, but just in terms of cases that would potentially require escalation. So I think as already been mentioned, the SPOC network events are really vital in the SPOC role in terms of that learning and development. I think something that I wanted to highlight in terms of perhaps issues relevant to particular local authorities. So in Sheffield, we have had a international social worker programme running for the past 3 years, I'd say, recruiting around 60 international social workers from predominantly African countries. And I think we've done a lot of work within our organisation about understanding cultural competency and recognising the different backgrounds and experiences of social workers. And if that becomes a fitness to practice issue, but having that clear understanding of different cultures and backgrounds. So I think that is a key area.
Well, thanks to all three of you. And I must say I'm really encouraged by this programme to develop the single point of contact. And I'm really encouraged by your presentations and also by the work that colleagues have done in Social Work England, because if we can get this right, ultimately we can have better services, but we can also stop a lot of distress amongst the workforce and amongst those that are using services as well. So I think it's really, really worthwhile, not to mention the economic benefits, of course, because it's actually such a costly exercise as well in fitness to practice. That's not my primary priority here, but we could use that money better elsewhere, potentially, if we manage to do some effective prevention. So some really good themes highlighted there, which I think are really important. So Gavin, you're going to tell me what the questions are for the panel. Give us a question. And you'll have to come off mute if you're going to give us a question.
I was going to try and get away this whole week without doing that at all, but it's not happened. So yes, we have a few questions, and what I would also say is to people in the audience, feel free to please keep them coming. We'd like to try and get through as many as we can, but Yeah, the first question really is how has the Spot network helped employers to manage regulatory concerns, and can you share any examples of positive outcomes?
Has anyone got an example they'd like to share from the panel? It doesn't have to be a completed example. It could just be what you're doing at the moment.
I think coming for myself, I think in terms of preparedness, of kind of the process and what information I might be required to provide to Social Work England, and some of the timescales involved with that, so that I could, begin to, to be ready, and to be, knowing the questions that I needed to ask before I even kind of agreed that, we were going to go forward with Social Work England.
Yeah, thanks, Joe. I think that's really important because I was asked what the thing that keeps me awake as chair of Social Work England, and really the only thing that keeps me awake is the waiting times for fitness to practice, in fact. So absolutely anything that any of us can do to make that process more efficient, because we can't actually finalize the back end of the process without having all our ducks in a row in terms of the paperwork, and the timings and the reports and so on that we need. Otherwise, it's just going to fall over. So the more understanding we have about that, and also it's easier for you in the sense we don't have to keep coming back and knocking on your door and saying we haven't got X, Y, or Z. But fundamentally, for the social worker and the witnesses, just to get that done faster, basically. I mean, Gavin, did you have any observations from our end about things people are doing?
Well, there's been a number of different positive pieces of work that I've seen, and sometimes what we do is we share that. But I think there's been some allusion to that, from our speakers today. But I think what I've seen is where you have an employer who, when they have a concern raised about somebody, they ask what's going on for that person. Has there been the right support to assist them with any difficulties they're experiencing? Taking that personalised approach, and recognising that there might be all kinds of difficulties going on for that person, and also maybe perhaps looking at what microaggressions might have impacted on that individual as well. It's not to make excuses for any fitness to practice issues, but to try and understand it and do what they can, preferably to prevent an issue arising in the first place, but then also to then address any problems, ideally before they get to the threshold of where it then needs to be referred to us. But I've certainly seen some proactive work going on, which is really good, and where we can feed into that with our learning, and then that's also, adds extra benefits, I think, for what we're talking about.
I mean, I think that's absolutely right. I mean, two of the key factors that bear on whether people can perform are not so much to do with their personal characteristics. They're the job design and the line management and supervision they're getting, which people have referred to already, particularly supervision. So, to understand the context is critical. Did colleagues want to add anything more before I go on to another question? Let's take another question.
So the next one is, what are the most common regulatory concerns that have emerged through the Spot network in the last year, and how can we address them proactively?
Well, I think I'm afraid you've set yourself up there because you've got the overview. But in a minute, I'll ask colleagues what the most common ones are in their authority. But if you could give the high level view, and then I'll see if it chimes with what colleagues have experienced.
Organizationally, what we see is the two. I'll tell you the top two. There's more, but these are the ones that stand out the most. It's communication, and the other is dishonesty. Those are the two top concerns that we see in the fitness to practice system.
Kathryn, I mean, what do you see in Sheffield, just generally in terms of maybe more broadly than FTP disciplinaries? What are the top issues?
I mean, I would add, as Joe and Kaylie have said, that the number that we have is relatively small, but I think that communication, as Gavin's highlighted, would be something that, would definitely come up in terms of the written and spoken communication as well. So we've had a fitness to practice workshop, as I mentioned, on dishonesty as well.
Yeah, thanks for that. Kaylie, did you have anything to add to that, or is that your experience?
I think our experience is very similar, and I think, like I mentioned, and I know Gavin touched upon it in terms of the dishonesty aspect, and we're finding them more from an aspect of when we are seeking external staff, potentially through maybe agency contracts or locum contracts, where we're seeing more kind of fitness practice concerns come to us to ask to be responded to, rather than those kind of internally. Kind of over this kind of past year, really, since I've took on Spock, that's been one of my main observation of the ones that I've been asked to look into.
Yeah, that's helpful. And something I that interests me as chair is that new and emerging issues, and obviously social media is not very new, but that's got bigger and bigger in terms of what we've seen, and how can we help people with these issues is critical to prevention. Stephen, did you want to come in?
Yeah, I can. I've got a list of some of the sort of top kind of referral reasons in front of me, so I think I could probably add a little bit to it. So yeah, so the primary concern from employers that we see coming in is around competence. That's a primary concern we get from employers, and from members of the public, it's around it's around dishonesty. And then in terms of a bit more detail, if the sort of top 5 concerns that we've seen coming from employers recently, professional practice is one of them, dishonesty, referrals relating to safeguarding, breaching professional boundaries, and then we also see referrals where there's criminal proceedings involved or convictions. And then it's slightly different for members of the public. So we all of those that I've just mentioned, and then the one that we have as well in the top 5 from the public is around bias or prejudicial treatment. So that's our latest sort of top 5s of referrals that we see coming in, slightly different from employers, from members of the public.
Yeah, but no real surprises across that. So the issue is what can we do? And of course, a lot of complaints from members of the public are actually about the service, which we've been increasingly rigorous about making sure that cases that go through triage are actually further down the line are actually about individual practice and not about the service, which is for others to deal with. Let's have another question, Gavin.
So we're being asked here, what are the top activities, or what? Just get my screen up again. What are the top activities or type of preventative work big employers such as local authorities and NHS trusts should undertake to promote professional improvement and or prevent future regulatory concerns for social workers?
Can I ask the panel, are there things either that you're doing that you think are of particularly high importance in prevention, or which, given an ideal world, you would like to do? Joe, would you like to have a shot at that?
Well, one thing that I seem to be spending quite a bit of my time with at the moment in adult services is around charging policy. And I think that charging for reablement services and charging for assessment beds or care home referrals. And I think that has quite a significant impact on people that use services, that if they're not given correct information, or if they're not given any information at all about charging. And I've really kind of like been considering like what my responsibilities are as PSW in order to kind of ensure that colleagues, really have the support that they need to have, accurate information at their fingertips and confidence to be able to give that information, to people when they're going out to see them around these issues. And some colleagues might need more support with that than others. So it really has, for me, I've spent quite a bit of time like really looking at our process around that, and how easy is that to read, how accessible is that to read, and making sure that colleagues really kind of like feel confident with that, because I've been looking at the number of complaints that we get around that, and I don't think we'll be the only local authority. And having spoken to some people, that have used our service as part of complaints procedures and also as part of fitness to practice, is the impact that that can have on people, particularly within the current economic climate, if they don't, kind of get accurate information about that.
I think that's very important, and I actually personally have lived experience of this. Although in the case where I was doing something personally, which was in relation to my father-in-law's charges, it was, of course, the social worker that helped us, because the social worker understood that some of his care needs were critical, and others said that didn't want to actually acknowledge that. But I think it's really important. Kaylie or Kathryn, what would your priorities in prevention be?
So I think the kind of priorities we're kind of looking at from our aspect is, again, I think you touched upon it, it's just communication really. So just communication, and that, for going back to the fundamentals of being social workers and what that means to be a social worker. And even if you don't know all the answers at that moment in time, when you are meeting with that person, still being able to communicate that you will come back and give that information. And being really kind of clear and consistent really in those discussions. I think across social work in general, obviously we're all now kind of coming back from the COVID aspect, and the way in which the profession worked then changed completely from the idea of now we're doing this virtually, and I think it's just about rebuilding some of those steps back in to really make sure that our communication when we are working with people is still of that level, and the professionalism as well, what that does now mean in this new area. I think something as well, and I think you touched upon it, Andrew, is around social media and AI. So looking at how social media and AI, how might that impact practice, and how might that impact possible fitness practice issues, especially if you look at technology to support with assessment writing or note taking. Is that going to be able to support us to look at those fitness to practice issues where they are? So they're kind of more of the kind of wider scale things that I would say we're looking at within all of our individual councils, but also across the PSW network in the Southwest, in terms of have we got that right guidance for staff to prevent fitness to practice issues in those emerging areas.
Yeah, very important. Anything to add, Kathryn?
I think just to reiterate what's already been said in terms of that early intervention and addressing issues, at the earliest stage, and having those reflective discussions. And I think it's a cultural thing as well, having a culture where actually workers feel supported and they can ask for help and guidance without sort of fear of the repercussions, and having that peer mentoring support, I think, is something that's been particularly helpful for us.
Yeah, great, thanks. I mean, Stephen, from your perspective in actually managing the process, how do you think we could address prevention?
Well, I mean, I think the network itself is a really good vehicle for it, because it's a dialogue, isn't it? So you know, we're sort of learning things all the time in terms of the kind of referrals coming in, and the, you know, the ones that we should be dealing, and the ones we shouldn't be dealing with as well. So I think having, you know, having attended the most recent network, it just seems like the healthier we can make the network in terms of, you know, participation from all local authorities, and the sort of the more regular our dialogue can be between Social Work England and all local authorities on this, the more we're going to learn from what's coming out of fitness to practice, and then put in place actions to actually you know, do work upstream, if you like, really. So I think just looking at some of the questions that have been coming through as well, I think there's a lot more we can do. It's relatively new as a network, really. So I think there's practical things we can do to actually ensure that there's sort of ongoing contact, and there's arrangements in place, because obviously people move on, and I'm sure we can put in place more robust arrangements going forward for continuity. And I think there's also scope to widen the network to other employers as well, which is, I think, some of the questions that I've seen coming through also.
Yeah, I was going to mention that because you know, I'm connected with a particular social care charity that employs a lot of social workers, and I know the NHS is increasing the numbers of social workers it's employing. So you know, local authorities will always be the most important, but we could draw learning from elsewhere as well. Let's have another question.
Yes. So another question here is are there overrepresented, the way it's worded, racial stroke ethnic groups? So are there any overrepresented racial ethnic groups referred to your fitness to practice system?
The answer is yes, but I'm afraid, Gavin, would you like to give any further details of that? I mean, this again, I've already referred to it. It's something we have to understand and we have to address.
Yeah, I don't know if Stephen wants to respond first, and then I can give you
Okay,
some.
okay,
No.
great. Stephen.
Okay, so I mean, I'll tell you what my understanding is, having been in post relatively recently. So as far as I understand it, I mean, we have done research in this area, and we have got an overrepresentation in terms of referrals that are coming in for fitness to practice. And Gavin, you may be able to correct me on this, but my understanding is that we've got an overrepresentation in terms of male social workers, an overrepresentation in terms of, I think it's probably over 40, people that are aged over 40, and also in terms of Black social workers as well. So I think that's what our research has shown us. At the same time, we are undertaking further research to try and sort of get underneath any of the sort of reasons for that, and the complexity around that as well. So
Yeah.
you're nodding, so that's good. So I think that's my understanding of where we are now, and we've certainly published some information about this and intend to publish more.
Yes, and I think you know, we don't know the precise details for some minoritized groups because that they are too small. But certainly we have evidence of overrepresentation, exactly as you've said, and it's similar. I've also worked with the General Medical Council. We also see this with doctors and other professionals, and there's some obvious reasons, I'm afraid, which we'll all be aware of people's experience of racism. And there may be less obvious reasons about people's access to continuing development and so on, and the areas they're working in. So that's what we really need to understand, because unless we understand all those dimensions, we can't address it. Gavin, did you want to add to that?
Yes, sure. And I mean, one of the things we are trying to do as well is work again with the single points of contact to talk about what can be done in terms of immediate sort of addressing of this, including on prevention. We know what the statistics tell us. The why behind each individual case is a different matter, and there's all sorts. There's no one reason of why this happens. So that's where that it's important for us to be having that dialogue, and things like good supervision can actually be very helpful with this, because again it helps with that understanding. And I've talked also to frontline to practitioners about what they might see as helpful in terms of prevention, particularly with overrepresented groups in the fitness to practice system.
Yeah, exactly. And we really need to think through exactly what people's experience is. I mean, I think I noted down the word personalised earlier from colleagues' presentations. So we need to understand people's personal journeys and what they've been through. Do local authority colleagues share the perception that we've just expressed?
I certainly do, Andrew. I don't have any experience of in a SPOC capacity in relation to referring anybody from a minority group due to race, but I do in relation to my role as a practice educator and my role with social workers in their assessed supported year. And I sometimes find that colleagues do need some support sometimes to kind of look at ways and maybe using social work theory to get a better understanding of what somebody's personal bespoke experience is, and when they've been supported to do that, and sometimes work around reflexivity and the link between not being able to be reflexive as a social work supervisor to somebody's individual experience has really helped to overcome that. And I think that's potentially why we've never had an issue with that in fitness to practice.
I think that's very important, and I have anecdotal but personal testimony from social workers who belong to various minorities about the supervision sometimes from certain individuals not being sensitive to where they're at and what they've been through and the impact that has on them. And we are anti-racist, we're anti-discrimination, so this is really, really important for us all. I'm not just sort of preaching to you. We have to all walk the talk the whole time. Shall we take? It's an area where we need to do a lot more work to understand the detail. Shall we take another question?
Sure. So I think something perhaps we've touched on some of this already, but it's just maybe worth just reading it out, seeing if there's anything additional to add. Really, it's about how the SPOC network has been helped to manage regulatory concerns more effectively, and if there are any any examples there.
Do you mean in terms of actually making the system work when we have to? I think Joe already referred to, or was it another colleague, to getting the paperwork ready proactively. Are there other examples about how colleagues, when they're able to work with us, have been able to streamline their work with us?
I would also say it's really supported in terms of the clarity. So the clarity of of a fitness practice concern, and then what that means for you as an employer, what that means for the individual going through the concern, and where those kind of boundaries sit, and where, obviously, depending on the level of seriousness, that kind of sits in terms of that aspect of what you're happening. I think it could be it's a process that is very daunting for anyone that goes through it. And it's also a process, I think, that can be quite daunting, or used to be quite daunting for an employer, to really recognise where your role sits, where the regulator role sits, and then how that works and how they come together. And I think having the SPOT network itself, and then also having our regional leads to link in with, alongside the fitness to practice team, it helps us to really hold the investigation a lot better, and also be able to support that person going through the investigation a lot better, and have that clearer communication. Because I know that we've spoken about, in terms of preventative stuff, having better communication with the adults that we work with, myself in adult social care, but it's also about having better communication with that social worker going through the process as well, so it doesn't seem so daunting, and trying to really manage the impact on their well-being that the process can have if it is drawn out also.
Yeah, I see you nodding, Kathryn. And I think it's something we also think deeply about. And of course, we have to be aware that there are witnesses and members of the public, and we have to be, impartial, as well as offering what support we can. So, it's something that we need to think about collectively.
I think that's one thing that attending the SPOT network has kind of helped me with a little bit, is in terms of being more like mentally prepared for the vast amount of information that Social Work England will actually request. It is vast, and it takes up a lot of time. But I did feel, by being part of the SPOT network, I kind of was anticipating that. And I was prepared, and was able to work, to work with the deadlines for that, and also some GDPR issues around contacting people who have used the service. I suppose within my social work values, it felt a bit uncomfortable at potentially having to speak and explain that you are going to be speaking to Social Work England and asking, would you mind your contact details being shared with Social Work England. Felt professionally quite an uncomfortable place for me, to start with, but having been part of the SPOC network, I think I understand a bit more why that request is made, and how to go about that.
Yeah. And I think this is something where we need to unpack exactly why we need the evidence. And of course, the last thing we want is for cases to be drawn out or fall over unsatisfactorily because we haven't got the paperwork right. But on the other hand, I know what a big burden that this is. So anything we can do to communicate and sharpen that up would be good. Any last comment on anything from the panel before I just hand over to Gavin to close for us? No, I think there's a lot of agreement and alignment here, and we're obviously coming from slightly different perspectives, but we're seeing the same problems. So basically, let's tackle them together. So thanks for everybody on the panel. I'm really grateful for your time, and I'm even more grateful for the work you're doing as SPOCs. And of course, I'm always grateful to staff at Social Work England, without which I can't do my job as chair either. And thanks to everybody for listening. But Gavin, you're just going to close up for us now.
Thank you, Andrew, and thank you, Joanne, Kaylie, Kathryn, and Stephen. It's been a really good session, and thank you all for your time today, and thank you as well to everybody in the audience for your questions and your time as well. So this brings us to the end of this session. Thank you again to our panel, and yes, thank you, and all to everybody here. Have a great day.